Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to go over the top 3 questions that I most often hear when it comes to knee replacement surgery. Before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our videos related to knee replacement surgery. So these are definitely not an all-inclusive list of all the different questions that I get. I get tons of different questions related to knee replacement surgery, both before, during, after surgery. But these are probably, if I had to pick, the 3 most common questions that I get and that I have to answer for patients and clients. So number 1, do I need a knee replacement? Of course, this is probably the most important question if you're someone who is dealing with knee pain and knee arthritis and symptoms that are causing debilitating issues. And the answer to that is, of course, going to be very individualistic. And, it's about the main thing I tell people to think about is your symptoms. So what is your pain? What is your pain intensity? How frequently do you have pain? When do you get pain? What activities does it impact? Does it impact your ability to walk? Does it impact your ability to do your job or your profession? Does it impact your quality of life when spending time with family or friends or doing activities with them? Your leisure, your recreational activities? Does it impact your ability just to function and carry out your normal day-to-day life and go grocery shopping or whatever that may be? And that's really the main thing you want to think about. And if those symptoms are getting so debilitating that it's impacting your quality of life, it's impacting your function, your independence, then that's when you really want to think about a knee replacement. Now, I wouldn't jump straight to getting knee replacement surgery. I would definitely look at the wide variety of conservative treatment options that are out there that can really have some benefit and definitely have efficacy in terms of helping many people to manage their arthritis, manage their pain effectively, that they don't necessarily need a more invasive, a more risk-involved treatment such as a knee replacement. So definitely look at those other options and try those other options. Physical therapy, physical activity and exercise. If that's, making modifications to your health and your well-being, maintaining a healthy body weight, things of that nature. If those things don't improve your symptoms after a period of time and improve them enough that you can manage it, then you want to start looking at more involved medical treatment approaches. And of course, probably the last resort, the last option would be a knee replacement surgery. So those are the 2 big things. Look at your symptoms and how much they're impacting your quality of life and your function and your mobility. And also look at, have I given a good try of the conservative treatment options before going and deciding on this last resort of needing a knee replacement. Number 2, pain and symptoms. So these I kind of clump together, and there's kind of questions related to these 2 topics. So this is kind of a cheating because there's more than one question within this. But the main thing I hear all the time with people who are rehabbing and recovering, is this normal? Is this level of pain normal? Is this swelling? Is this redness? Is this stiffness and tightness? And is this prolonged inability to have difficulty and issues with things? Is that a normal part of the rehab and recovery? And the vast majority of times, it is. It's very intensive rehab and recovery. You're going to have pain and swelling and stiffness and a lot of symptoms, especially early on after surgery. And for some folks, unfortunately, that can last for quite a while. Now, of course, if you have any concerns, never hesitate to reach out to your doctor, reach out to your physical therapist, and just double check. It's better to be safe than sorry, of course, but vast majority of time, it's kind of tends to be the nature of the beast. It's part of that rehab, that recovery. There's going to be some pain and stiffness, but hopefully you can work through that with your physical therapy, with your healing and recovery. And also on top of that, I get the question of how bad is the pain? How intense is the pain going to get? Unfortunately for some folks and quite a few folks, pretty bad, pretty intense. You really can have quite a bit of pain and discomfort, and especially early on after surgery, those first few days to those first few weeks, it's going to impact your ability to sleep well. It's going to impact your walking. You're going to feel it. You're going to feel the swelling, the pain, the stiffness. It can get pretty bad, but the good thing to know is that you have a new knee, a prosthetic knee replacement in there, and the vast majority of folks with the rehab, with the physical therapy, with time, will heal and recover, and their symptoms will decrease, their pain will decrease, and they'll get back to living a quality of life and having a level of participation that they are happy about. So it can be really bad, but there's a light at the end of the tunnel. That's important to keep in mind. And then, of course, that same question is, how long does the pain last? Again, it's going to vary for everyone, but you want to think about a marathon, not a sprint. It's going to take a while to really rehab and recover and feel fully back to your normal self. There's the first 12 weeks, 3 weeks of, you're probably doing physical therapy for at least a majority of that time. And then you might be, maybe 75, 80% recovered at that point. But then you're still not, you're still healing, you're still recovering even after your physical therapy is done. The timeline I always hear is 6 months. You want to think about 6 months till you're really fully recovered. But it can be longer than that for some folks. It can be up to a year and a half, even more than that. Each person's going to be different, and that's not necessarily a bad thing. It's unfortunate because you wish to recover as quick as you can, but just understand that everyone's going to kind of go at their own pace, but you can still see improvements, you can still see changes and improvements in your pain and your symptoms, even pretty far out, months to over a year out after surgery. Moving on, question number 3 is, how long is the recovery after knee replacement surgery? So we talked about the pain and the symptoms, but how long is the recovery in general? And like I was saying, you're going to have your physical therapy. Most people, that's maybe 6 weeks, 8 weeks. If you go a little bit longer, maybe 12 weeks or so, 3 months of physical therapy and recovery and rehab. But then, you're not necessarily totally recovered. You're maybe 75, 80% recovered, and that last 20% that you're kind of basically managing by yourself or managing with other resources, that's going to take a little while. So that could take, again, up to that 6 months. It could take longer than 6 months. You might take a year and a half. For most people, when it comes to the pain, when it comes to the stiffness, the symptoms, it's going to be a gradual decline over time. You still have every now and then these episodes where you might have a little flare-up of symptoms, a flare-up of discomfort, and then it kind of calms down, and then you kind of gradually get better again, slowly and surely. It's not one of those things where you wake up one day and you feel like, oh my gosh, I'm 100% totally better. It's a slow, progressive, again, a marathon, not a sprint. So it's many months. It can take up 6 months, a year and a half is not unheard of for really feeling completely recovered and healed after surgery. So those are 3 great questions. I have one last one here. Just a bonus question is, how long does a knee replacement last? And again, this is a fluid answer. It's, we have a lot of new technology, different plastic components, for example, different surgical techniques, robotic arm-assisted surgeries, and we don't have a ton of data yet to see how long these are lasting. So, initially, you heard here maybe, 10, 15 years, if you're lucky, maybe getting up to those 20 years. But, a lot of surgeons and a lot of healthcare professionals are optimistic that, the newer knee replacements and with different management strategies and physical therapy, you can really have knee replacements that last a very long time, 20 years, over 20 years, even getting up to 30 years for some folks. So again, it's going to vary from a lot of people, but they're seem to be lasting longer and longer for folks. So I hope you found this video insightful. Again, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos. Be sure to hit that like button to help spread this video to other viewers. And as always, please leave your comments and your questions below as I do my best to get back to everyone I see. Thank you very much for watching.